breast cancer. These two words sparks fear and silence in women. But this is not a story of just pain, but of courage, survival, and early detection. One will be wondering why we are wearing pink. October is our Breast Cancer Awareness Month. And on GH Police TV, You and Your Health, we are shining light on this important topic. If you are watching us, we are live on GH Police TV, DSTV channel 362, and all our social media handles, Ghana Police Hospital on Facebook and YouTube. My name is ASP Kafui Ajimai. And to help us understand the topic breast cancer, our guest is in the person of DSP Mrs. Harriet Owusu Aja, an oncology nurse specialist and the nurse manager of the male ward at the Ghana Police Hospital. She's been in contact with patients and survivors of breast cancer. Madam, you are welcome to GH Police TV.
Thank you very much.
Now, an oncology nurse specialist. Please enlighten us on that.
An oncology nurse specialist is actually a nurse that went to a training, 3-year training at the Ghana College of Nurses and Midwife, and trained to take care of people being diagnosed of cancers, any other type of cancer, especially adult cancers.
Great. What exactly is breast cancer and how does it develop in the body?
So before I zoom onto what breast cancer is, I'd like to talk about what cancer is. So cancers are actually a disease in which the cells abnormally grow out of control. And we have something called, and I'll break it down, apoptosis, which means naturally we have cells in all parts of our body, which grows, they die off, and they have replacement. That is the natural nature of how cells work by God. So these cells, when they refuse to die for a new one to grow, they replicate. That means they multiply. They grow out of control and forming tumors, mass, etc. in any other part of the body. So it means that cancer can happen in any other part of the body.
Wow.
So zooming down to breast cancer, it means that a cancer in the breast tissue. Thank you.
When somebody hears that, I have breast cancer, not you, when somebody hears that, what is usually their first reaction?
Well, usually when they have breast cancer and a diagnosis is being made and the news is being broken to them, or they break the news to them, some become suddenly mute. Mute is if they don't even talk, they can't talk, utter a word. They just stare at you. Some also cry, some also wail and scream. That why me? They start asking questions. That is what usually happens.
Okay. So there are a lot of myths out there. You know where people say when you wear tight bras, you are eligible to have breast cancer. And some people also think it's spiritual. What are some of the myths out there?
There are so many myths, but these few ones, most of the times on the black braziers, they usually say those who wear black braziers have breast cancer. But braziers, even in research, never showed anything of relating to breast cancer. So that is that aspect. Another one also says herbal and diet can cure breast cancer. It means when you have the breast cancer, you do with the herbal and the diet, you'll be okay. No, you already have the cancer, so you need care. Preventive measures are where the diet comes in.
Wow.
And some also say there's even a myth that when you are pregnant and you have cancer, you deliver a baby with cancer. It's also a myth. It's never so. It's not true.
Another one that I know of is that only old women can get breast cancer.
No. It's also a myth.
Okay.
Other young women, even teenagers, some teenagers do have breast cancer.
Wow.
Yes, children have breast cancer. So it's not only old women.
Another myth is you can't survive breast cancer.
Breast cancer can be survived. This is where early detection saves lives comes in. When you come promptly, they detect it early, your life can be saved.
Great. Just to clarify, can men also get breast cancer?
Yes, of course. Men also can have breast cancer,
How
but
is that?
it's most common in women. The female gender, it's common in them. But with the male, 1% of men can have breast cancer. So taking 10 men, one can have breast cancer. Taking 100, 10 of them can have breast cancer.
So for a woman watching us today and sort of see a lump in the breast, what should that woman do?
That woman shouldn't panic. There's help out there, so many help out there. Ghana has reached where we could, or we are taking care of cancer cases. Professionals all over.
Okay.
So this woman should just look out for any clinic, hospital, whether tertiary, secondary, for further professional examinations and tests requests to be done. Because it's not every lump in the breast that is cancerous.
Okay.
So
moving on to the signs and symptoms, what are some of the things that, apart from maybe a lump in the breast and maybe pain, what are some of the symptoms that one can pick up?
So usually there will be a change in the size and the shape of the breast. It's not as usual. Then there would also be, or there could be discharges, either bloody, yellowish, any other color discharges in the breast. Then the nipple could also be, naturally some people have invented nipples. Nipples that are sunk inside, like they are dimpled.
Okay, so they are dimpled.
Dimpled naturally. It's different from what I'm coming to say.
Okay.
So suddenly you realize that your nipple that is erect is dimpled, is sunk inside.
Okay.
That is where the problem is. Okay. It means that it's one of the signs. And having one sign doesn't mean you have cancer. There could be 3 or more signs and other diagnoses too. Then also there could be redness of the breast. Okay. There could be rashes on the skin of the breast. There could be warmth or hotness of the breast. You feel hot. There could even be pain. Most cancers are not painful.
Okay.
But just few of them, maybe in an advanced stage, there could be pain.
Yeah. What about the skin of the breast?
There could be rashes there. It could look scaly, which is not normal, as you know, your normal breast, how it looks like, especially the skin around it is smooth. So it could be scaly. It could be, there could be rashes. It could be reddish, or dark.
Great. So now let's talk about people who are at risk. Can you say that our lifestyle, family history, what can put a woman at risk?
So the risk factors in breast cancer are divided into 2. Okay. We have modifiable ones. It means that we can do something about them. The non-modifiable, we cannot do anything about them. So I'll start with the modifiable one. Modifiable one, you take lifestyles, for instance. How you eat, the things you eat really says a lot. Fatty, saturated diets, could cause or lead you to any other disease, even including breast cancer. Yes. It's one of it. It means you could do something about what you eat, because you decide what you eat. Then you go to alcohol intake. Okay. People drink. Yes. Then you go to
have a sedentary lifestyle. You can do something about it.
Yes, of course. Great. Then the non-modifiable ones, that means you can't do anything about them. Gender is one. The fact that you are a female, a woman, you have breasts. You cannot do anything about you being a woman or a female. That is one. Then your age. As you age, there are so many things that happen to ourselves. You cannot do anything about you celebrating birthday every year. You can't do anything about it.
Hormones.
Yeah, hormones. Then genetics. We have genetical mutations that happen. Some particular tribe, some particular, I would say ethnic groups, some particular breeds of humankind, they have this gene. You don't tell God you want to be a black or a white. So it's also another non-modifiable. Then another one is family history. We don't decide which family to be born in. So you cannot do anything about it.
So it means that family history means that a grandparent, a parent has that.
Yes, but also that doesn't mean that you automatically or is certain that you have breast cancer. Okay. It's a risk.
Yeah. That's interesting. So for those who have family history, what precautions can they take? I mean, if you have such in your family?
So with family history, then it means that you should be very, very, you should take your routine checks very seriously.
Wow.
Yeah, it's very important because you need to check, especially when, depending on the age.
Okay.
When you're in your 20s, even teenagers from 18 to 20, they start breast examination, breast self-examination. They are being taught all over churches, schools. They know how to do it. Then when you are in your 20s, 30s, you could also every 3 years do a clinical breast examination.
Wow.
Because the breast examinations are in twofold. Either you do it for yourself or you go to a professional at the hospital for it to be done for you. Then mammograms, when you are 40 and above, mammograms. But sometimes below 40, that is 35, you could be requested to do mammogram. Why am I saying this? Then it means that 35, when a doctor or a nurse specialist requests a mammogram to be done at the age 35, it means that you have a high risk of breast cancer or family history of it. So it's good for it to be done.
Great. Mammogram. Mammogram, sometimes it sounds scary. Yeah. And sometimes people think it's also painful. What do you have to say about that?
So mammogram is just a diagnostic tool for the doctor or the specialist to know the type of cancer and whether even the cancer is there. And it's painless, less time consuming. Within 20 minutes, it's done.
Wow.
Usually, it's you have to undress your upper part of, expose your upper part of your body.
Great.
Then the thing is in a slide form.
Okay.
Then the breast is put between two slides.
Okay.
Then squeezed a little.
Okay.
It's not that type of
Not
squeezing
the
that you
pressure.
feel pain, pressure that you feel pain. Then the imaging is done. All the other things that the machine needs to pick, the mammogram machine needs to pick, picks it up.
So to sort of take pictures of every part of it.
Yes, they sometimes even do the armpits because we have lymph nodes and all that there that could have the cancer without going into the breast yet. So you could pick all other things that need to be picked.
So US is not scary and it is not painful. So be informed. Moving on. If we could do a simple daily habits as women, what would you advise us to do?
So
to help prevent breast cancer.
Okay. So with the daily habits, our advice, we can even take a walk. If you can jog, you can jog. But taking a walk, brisk walk, 30 minutes every day or even twice in a week or thrice in a week off our busy schedules, it will help. That is daily. And there are other things we can also do. Breast self-examination, very important. So this boils down to its age limits. So women who are not menopausal, they are still having their menstrual periods. So after their menstrual period, that is 3 to 5 days after the menstrual period, they could do breast self-examination. They have ways in which we'll demonstrate it soon. They'll do it. Then the menopausal women, they should pick a day and a time, specifically so for example, in October, 1st October, 10 in the morning, I'll do my breast self-examination as a menopausal woman, as an example.
Okay.
So every month, they could do that, and it will also help. And routine screening. So when you usually do the breast self-examination, and you realize that this month I would like to go to the check-in in the hospital for a professional touch. That's what we call clinical breast examination. It means a professional will also examine the breast to see whether there is something. It's just good. It's better to clear doubts than to be in.
So I think one thing, or let's say two things we have mentioned here would be the breast examination and then the mammogram. That is for the diagnosis. Now with the treatment, is surgery the only way to survive breast cancer?
No. Surgery is not the only way or the only treatment modalities. We have so many treatment modalities, but all boils down to when the diagnosis is being made, there are so many things they look out for. Your age, even your health status, whether you are, some people really have chronic illness that could have a different way of treating their breast cancer. So your age, your health status, the type of breast cancer that you have, the stage in which you brought the cancer, like the stage in which the cancer is. Okay. All these things are the things they look out for the treatment. So it shouldn't just be surgery. Sometimes, apart from surgery, even the surgery is not only about removal of your breast. It depends on the stage. So they could remove your breast totally. They could remove it partially. They could just even take the lump off. Out of it. So these are some of the modalities, depending on whatever you present, your presentation, and the timing. So apart from the surgery, they also do, how do you call it, radiotherapy. Radiotherapy, just like an X-ray. How we go to take an X-ray in the radiology unit. So we go and take an X-ray of your chest. That is how the system works. So it targets the cancer. They also even have immunotherapy.
You can just do that and you'll be fine. I mean, depending on the stage.
Depending on the stage. Sometimes we do it in combination with the surgery. Even some of the surgeries, there's even chemo. Chemotherapy is also another treatment modality. So chemo could be combined with surgery, it could be combined with radiotherapy, depending on which one you finish and start one. It could even be one, depending on your stage. So with the surgery, sometimes they could do chemo for you before the surgery. We call it neoadjuvant. Before the surgery, they give you chemo. They have a way to let the chemo have effect on the cancer and shrink it before it's taken out. Wow. Sometimes too, when they take it out, they take the lump out, then you will do another chemo. So that one we call adjuvant chemotherapy after the surgery, depending on the stage and what type of surgery that is being done. We even have immunotherapy, where the immune system is being boosted for it to fight against the cancer. Hormonal therapy, where they see which hormone is causing the cancer. You have estrogen, progesterone, HER2, positive or negative, however it is. These three hormones, they have a targeted therapy for it, so hormone therapy. So these are some of the treatment modalities.
Viewers, if you are watching, this is You and Your Health, and we are talking about breast cancer. We are going for a break. Stay tuned in. You know what I find funny?
No.
That women never forget to check their phones, their messages, or even their makeup, but somehow they forget to check their breast, and that one check can actually save your life.
Exactly. Breast cancer is not about diagnosis. It's an emotional journey that one goes through, and it affects the family, the friends, and community as a whole. So we are here to tell every woman that early detection is protection.
Hope and light, we are sharing amazing stories and practical tips on saving lives. And Police Ladies Association, Polas Medical, in collaboration with Police Hospital, is here to create awareness in this month of October.
So join us on Monday at 10 a.m. on Ghana Police TV and other social media handles, Ghana Police Hospital, on Facebook and YouTube. Join us on the conversation where we talk about the breast self-examination, early detection, and the power of the community support.
Remember, early detection is love in action. Wear pink, tune in, and share the message. You and your health. Let your health be your priority. Welcome back for our break. If you are watching us, this is You and Your Health on GH Police TV. We are live on all our social media handles, Ghana Police Hospital, on Facebook and YouTube. And we've been having a discussion on breast cancer with our guest, DSP Mrs. Harriet Owusu Aja. Madam, before we went to the break, we spoke about what breast cancer was, how you get to know that you have breast cancer. And there was another interesting part that I personally I'm eager to hear, and that is the self-breast examination. Please walk us through.
Okay, so with the breast self-examination, you stand in front of a mirror. So it means that you undress yourself, private. This is private. So you undress yourself. Be in front of a mirror, standing in front. So you could be in two positions. You can either be standing in front of a mirror or you lie down. We could also call it a reclining position. So in front of the mirror, I have a breast dummy here. So you stand in front of the mirror. First of all, you put your both hands on your waist and lean forward in front of the mirror. What you are doing here is you are inspecting your breast to see the size of your breast, how it looks like, whether it's now looking bigger. That is the inspection side of it. So both hands on your waist and leaning forward, standing in front of the mirror. Then after that, you use your left, if you want to examine your left breast, use your left hand.
Sorry to interrupt. With the inspection,
yes,
you said something earlier about rashes, discharges. Are you looking out for all that?
Okay, so in addition to looking at the size, the shape, so you could look out for rashes, reddening, darkening of the skin around the breast. You could even look whether there's a lump or a bump on the breast. It's also part of the inspection.
Great.
Then, if you want to inspect your left breast, you raise up your left arm, put it at the back of your neck or your head. This really what contracts the muscles here and expose the breast wall for whatever you want to feel. So this is my dummy breast here. So we have different shapes. So if you want to examine the right, you put your right hand at the back of your neck or your head and use your left in examination. So you realize that there are patterns that we use in doing the breast examination. So I'll use the breast dummy to demonstrate the pattern. So as you can see at the back of it, we have dummy cancer cells, lumps in the breast. It's showing here. Then, so to be able to feel this lumps in the breast, the first pattern is you could use a vertical pattern, meaning you are doing it in a straight line from top to down. So you palpate. Don't forget, you are using these 3 fingers, the padded part of the fingertips, these 3. Then we call it palpating. So in up-down movement, in a vertical movement, that is one pattern. You can also do it in a clockwise. How our clock look like? Clockwise pattern. You could also do it in a wedge-like. So it means from the top to the middle, you wouldn't get down as we did in the vertical. Top to the middle, round to cover the whole breast skin. Then don't forget, then you squeeze the nipple. You squeeze it out to see whether there will be any discharge, yellowish, bloody, sometimes greenish, because in your normal breast, you don't have all those discharge. You could also see whether the nipple is invented. It's also another. That one,
invented
that being,
in what sense?
whether it's like sunken, I'm using the word, so let me use dimpling for you to understand. Dimpling of because people naturally have dimple or invented nipples. Naturally, their nipples are in.
Great.
It's not out like the dummy is showing. It's in naturally. But that is just few female. But if you have a nipple in this form, and suddenly one day during your inspection or your routine examination, you realize that it's dimpled. It means it's sunken, has invented, sinking in there. It means there's a sign there's something wrong with your breast. Not necessarily you have breast cancer, because as I said earlier on, one sign could even mean a breast disease, not cancerous. So that is about our breast self-examination. Then this is what it is when you are standing with your arm, alternatively. Then when you can lie down to, still lying down with the arm at the back of your head and doing the same thing just I demonstrated here as are demonstrated here. So that is all about the
Great.
breast self-examination.
So, self-breast examination, can your partner help you with it?
Sure. So there's this myth that partners help and they even cure the cancer. So the fact that your husband, your partner, your lover really, I would say, massages, palpate, or whatever it is to the breast, it means you don't have breast cancer as a female. This is a myth. It doesn't happen like that. It's not true.
You know how some people just think, even especially for the men, that they think when you massage the breast or you do all kinds of things with the breast by all kinds of things. I mean, stacking and all that, it will help cure
or prevent cancer.
Prevent cancer, yeah.
No, it helps prevent in this way that I'm coming to talk about. Because when it's your partner, it's your lover, you know how the breast looks like. So during maybe the touch, and you feel a lump, you know there's something wrong. You feel like, Harriet, your breast has become bigger than it is. You are even not in that time of the month, you know, during our menstrual period, you have a little bit. This one, it seems this side is even swollen. So the partner or the lover or the husband can detect those signs and prompt treatment to be given. But not, I know the men will come after me, but this is the truth. It doesn't cure or prevent, but it helps. In terms of prevention, it helps. That is the early detection. Because when a man sees that, you encourage the woman to go for help at the hospital. For further, it's even a breast infection, not breast cancer. But it doesn't cure it. Second, it doesn't cure it. It's for your own romantic
pleasures. Interesting. That's a very good one. So moving on to chemotherapy. You know, when people go through chemotherapy, it's stressful. What emotional support do you advise that they get, even for the people who are the patients and for families who are supporting?
So chemotherapy is one of the treatment modalities, and it's a systemic treatment, meaning that it's in form of a medicine in a drip. Drip meaning when we go to the hospital, the infusions, the IV fluids they give us. That is how the chemotherapy setting is. Most at times. We have some even in the pill form and other forms, but that is most at times what we use. So it's like it's running through the veins and through the system. So this woman diagnosed of breast cancer going through this therapy would have so many systemic side effects. Sometimes the hair will be off, alopecia. Sometimes you'll have loss of appetite. Sometimes they'll have nausea, vomiting, all this. And so they need care. They need love from their loved ones. It could surprise you that most of the men run away when their wives or partners have been diagnosed of breast cancer. They run away. Sometimes it's not their fault. The fact that you've seen your wife's breasts having an issue, it's scary because you know men, funny enough, we said earlier on, they like playing with the breast. So this is the moment where this woman needs the help from the partner, because I believe that when the breast was fine and nothing was wrong, you were there.
Yes.
So if the breast has an issue, you should be able to be there. Support system, it's important. It helps them in treatment, as in their recovery early, because psychologically this mind really does everything, the magic. It helps. So I entreat, and even churches, the groups, association that the woman or even the man belongs to, all these people are needed. It's like a community is affected, so we should support them.
What informed what you do now? Do you have a reason why you decided that you were going to pick up the thing about cancers, adult cancers, and go deep into it? What informed this?
Yes. It's an emotional thing to really put out there, but I would have to say it for the purposes of other people watching or viewers. So I had an auntie who was a policewoman, a commissioner, of course, who died of breast cancer. Then her friend, who was also a police commissioner, a woman, also died of another cancer which was not even breast. Then we had other colleagues that died of breast cancer. Actually, I don't really know. It was just in a time frame of 3 years, 3 to 5 years, 4 or 3 of them died, just like that. So that sparked me, and I even happened to nurse them with some of our doctors that then were taking care of people diagnosed with breast cancer. So nursing them, then I said, no, I have that passion to help people in being diagnosed with breast cancer. So that was when my passion sparked.
Wow.
And that made me to really
Now, living beyond breast cancer, they have gone through chemotherapy, maybe even surgery, and they have survived. What is survival like after breast cancer?
Survival after breast cancer is a mixed feeling for them, I would say. Very nostalgic moment for them, because it's like they are happy. And because we know that sometimes even in the risk factors, if you've ever had a cancer before, you could have another cancer. That's how come I said it's a mixed feeling. But everybody or everyone being diagnosed of any cancer, especially breast cancer, that has survived would really never go back to anything bad, but always move towards the things that would jeer her or him not to have cancer anymore. So in doing this, most of them, they like to what? Create awareness, talk about their journey, how it was, their stories, for people to learn from. In terms of preventive, and even those being diagnosed to follow suit.
So somebody who has survived cancer, breast cancer, I mean, does the person have to live his life differently? And when it comes to lifestyle changes and all that?
Not really. Not really, because you survived it. That doesn't mean you won't eat. We need balanced meal. Just like you should eat well, healthy meals, exercising. Some of them are still on some medications. They come back. So whenever they are on survival, we put them on remission. We call them they are on remission, meaning that they don't even have to come for any treatment, nothing. But they have appointments. They sometimes do it they start with every 2 months, every 3 months, sometimes even every year, once every year, once every 5 years, depending as you move along with the survival. And some even don't go to the hospital at all. They don't take medications at all and all that. So in terms of this, at the end of the day, they don't need any change in lifestyle as seen. Not the risk factors that I mentioned. They themselves will not go back. But it's all geared towards healthiness, healthy lifestyles. That is all.
One. Now, as survivors in the society, what do you think? I mean, you have worked with a lot of them. What do you think is the message they wish everyone would know?
They wish they are not being stigmatized. Stigmatization. Hey, this woman is had breast cancer, so don't go and marry the son. Stigmatization. Because it's not their fault of being diagnosed with breast cancer. Neither breast cancer knows no bound. The boundary, anybody at all can have breast cancer. Whether you are beautiful, ugly, rich, poor, you are learned, illiterate, anybody at all at a particular point in time in life. So they having it doesn't mean that they are outcasts of the society. So stigmatization, it should stop.
So when you see women wearing pink like we are wearing pink, what does it mean to you as an oncology nurse? I mean, wearing pink and celebrating life.
Wearing pink is symbolizes breast cancer awareness and giving hope to people who are already been diagnosed of breast cancer. And it also shows that the community supports them in all that they do. Anything about breast cancer. That's the meaning of the pink and the ribbon.
So now coming to Ghana Police, do we have support groups? What interesting thing do you have for us in this month of October?
So in this month of October, we have Ghana Police Ladies Association. That is one of the strongest support group for police ladies who are being diagnosed of breast cancer. Unless we are not aware, unless you keep it as a secret, because in this case, you will decide to tell and you'll be helped. When you tell, you'll be helped. So Police Ladies Association have this collaboration with Police Hospital. All the police women that have been diagnosed from today, it's been there for like 2 years now, but we are still creating the awareness. Diagnosis of breast cancer, they would refer you at the hospital, a police hospital, to Sweden Medical Center. There's a collaboration between the Police Ladies Association and the Sweden Medical Center for full treatment of a woman police being diagnosed with breast cancer. Not more than 3 of his dependents, that is children, not more than 18 years old, then their husbands, they are entitled to that full treatment. It means that any of those dependents being diagnosed with breast cancer, together with her too, can, or will be treated. Will be treated.
It's not just breast cancer.
No, any other cancer will be treated. Then,
what special thing is Police Hospital having for us this month?
So Police Hospital also has a walk-in screening, free screening at the public health unit or department at the police hospital from Mondays to Fridays. That is 8 a.m. to 2 p.m. Just walk-in. In this October, free screening of breasts. They would do that for you.
Great. So if there's a woman watching here right now who is afraid to tell her story, who is afraid to tell somebody that she has a lump or this is what she has seen, what advice you have for such a woman?
Okay, so before
your last words.
So before then, I would like to add up that the Police Ladies Association, apart from you, the dependent in active service, you, the policewoman in active service plus your dependent, when you retire and you have been diagnosed of any cancers, including breast cancer, you are entitled for treatment alone, but not with your dependent this time. That's what I want to add to my previous submissions.
So your last words, please. Any advice to any woman out there?
So I would just like to tell every woman out there that it's not scary. Treatment is not scary. Anything about breast cancer is not scary. But it's good to do your routine screening. Whenever, I always say that you could use any month that you are being born, like your birthday month, to do this routine examinations, especially clinical mammogram, where applicable, as a birthday gift for yourself. During the year, I'm a June born, so every June or every 2 years in June, as a birthday, first birthday gift before the cake and other things, the studio shoot and all that is very important. You do the examination as a gift to yourself. Then in doing this, it will help you because early detection, almost all the survivors that you see, most of them came early. And they are now spreading the word to all of us, how the journey was. Because most of the cases, as in 70% of the cases, come in advanced stage. And the professionals cannot do magic. They will not throw you out, they will still give you hope until daddy calls you home. And we don't want it to be like that. But when you come late, it's a whole lot. Even though we do our best, and some to survive, just for a few years because you came late. It has invaded all other organs and nothing can be done much. Palliative care is also one of the treatments that could be done then at the advanced stages. Palliative care is just to make your quality of life easy. So emotional support till death, emotional support, psychological support, and spiritual. Those are the 3 branches of palliative care they will give you. Emotional, those are support groups. Spiritual, if you are a Muslim, your imam will be with you all those moments. If you are a Christian, traditionalists, you involve yourself in all this to help you. So please, early detection saves lives. Just don't be scared. Don't have any fear. Boldly, confidently walk to any health facility for the routine examination. Thank you.
Thank you very much for coming.
Thank you too.
Thank you to DSP Mrs. Harriet Owusu Aja for sharing with us your knowledge and passion today. And to our viewers, early detection really saves lives. So come to the police hospital, the public health unit at the police hospital, where free screening is ongoing as at now, so that you can be able to detect early enough for treatment. And to our cherished viewers, our men, please support us. Our family members, please support us. Get involved in our treatments. This has been You and Your Health. My name is ASP Kafui Ajemai. Let your health be your priority. Thank you.